Your skin, your nails, your breath, they're all trying to tell you something. And most people completely miss it. I've been researching chronic kidney disease for years now. And the one thing that keeps showing up in the data over and over is this. People had the signs, they just didn't know what they were looking at. Up to 90% of people with chronic kidney disease have no idea they have it. Not because there are no warning signs, because those signs look like everyday life. Tired all the time, legs a little puffy, skin itching at night, foamy pee you've been ignoring for months. If we catch this early, and I mean early, the research shows we can actually treat the root cause and stop the damage before it gets serious. I'm Maya Chen. I'm a biomedical research analyst, and today I want to walk you through 17 signs that your kidneys might be struggling. Signs you can actually see. Some of these you can check right now while you're watching. And let's get into it. Before we get into the signs, I want to give you a quick picture of what your kidneys actually do, because most people think of them as filters. And yes, they filter your blood, but that's maybe 20% of the story. Your kidneys also control your blood pressure. They regulate your electrolytes, sodium, potassium, calcium. They tell your bone marrow to make red blood cells. They activate vitamin D. They balance the acid levels in your blood. 2 organs, the size of your fist. So when they start struggling, everything starts struggling. That's what makes these 17 signs so easy to miss. They show up everywhere. Sign number 1, foamy urine. Not a few bubbles that disappear in seconds, a thick, persistent layer of white foams sitting on top of the water like the head of the beer that's still there 30 seconds later. Here, that's what's happening. Your kidneys have about 1 million tiny filters called glomeruli. Specialized cells lining those filters create a living barrier designed to keep large molecules like protein inside your bloodstream where they belong. When those filters get damaged, a protein called albumin starts leaking through into your urine. Now, albumin is symphophilic. That's a chemistry term, meaning it has both water-attracting and water-repelling ends. That structure is exactly what allows it to reduce surface tension in liquid and trapped air, which is why it creates foam. The same property that makes soap foam, same physics, different molecule. A review published in PMC in the Clinical Journal of the American Society of Nephrology confirmed that persistent foamy urine is a recognized early warning sign of proteinuria, and that albumin's amphiphilic structure is the primary driver of urine foam in kidney disease. So that foam in your toilet, that protein your kidney was supposed to keep in your blood. Next time you use the bathroom, look. Foam that's thick, layered, and still there after 30 seconds is worth paying attention to. Okay, I want you to do something right now. Roll up your pant leg. Find your shin, the bony part of your lower leg. Press your thumb into it firmly for about 5 seconds. Then let go. Did it leave a dent? If it did, that's called pitting edema, and it's directly connected to what we just talked about. When albumin leaks out of your blood, fluid follows, and that fluid has to go somewhere. It goes to your tissue, it follows gravity, which brings us to sign number 2. Sign number 2, swelling. And I don't just mean your legs and feet, that's where people notice this first. Here's the connection. When albumin leaks into your urine, your blood loses the protein it needs to hold fluid inside your blood vessels. Without enough albumin, that fluid seeps out into your surrounding tissues. Gravity pulls it down, so your ankles puff up. Your feet get tight in your shoes by the end of the day. But here's the part people miss. That same fluid can also collect in loose tissue, like around your eyes. So if you're waking up with puffy eyes that aren't from allergies, that's worth noting. And here's a cruel part about this cycle. Even though you look swollen, you're actually dehydrated inside your blood vessels. Your kidneys sense that and try to help by retaining more salt and water, which makes the swelling worse. It's a loop. Sign number 3, fatigue. And I know everyone is tired. That's exactly why this one gets missed. But kidney fatigue is different. It's not I didn't sleep well tired. It's I slept 8 hours and I still can't get off the couch tired. Here is why. Your kidneys produce a hormone called erythropoietin, EPO. EPO tells your bone marrow to make red blood cells. Red blood cells carry oxygen to every organ, every muscle, every cell in your body. When your kidneys are damaged, EPO production drops, fewer red blood cells, less oxygen delivered. Your body is running on empty. This is called anemia, a chronic kidney disease, and it's one of the most common and most overlooked symptoms. You know Lance Armstrong? The reason EPO became famous in cycling was because injecting it artificially boosted red blood cell production and performance. Now imagine the opposite. That's what damaged kidneys do to your energy every single day. It's exhausted for no clear reason, and it's been going on for months. That's not just stress. Get your kidney function checked. Sign number 4, itchy skin. Not dry skin itchy, not allergy itchy. This is full body itch. Usually worse at night, that no cream, no lotion, nothing topical touches. Because it's not a skin problem, it's a blood problem. When kidneys can't filter properly, uremic toxin accumulate in the bloodstream. Two of the most studied indole sulfate and picrassol sulfates are produced by gut bacteria and normally cleared by the kidneys. In CKD, they build up and activate protease-activated receptors on nerve endings in the skin, specifically PAR2, triggering chronic itch signals. Documented that approximately 40% of patients with end-stage renal disease experience this kind of itch. A study found that in a large international survey of dialysis patients, nearly 17% of those actively experiencing itchy skin never even mentioned it to the doctor. They had normalized it. They thought it was just dry skin or age or stress. You can find both studies at and the DOPS study referenced within. The itch has no dermatomal pattern. It doesn't follow a nerve line. It's generalized, it's symmetric, and it's worse at night when your body's still. If you've been itching for months with no explanation, especially if it's worsened at night and nothing topical helps, that's not a dermatology problem until your kidney function has been ruled out. Sign number 5, getting up to pee at night. And I want to address a myth here, because almost everyone gets this wrong. Most people think that peeing a lot means your kidneys are healthy, more output, more filtering, right? Not exactly. One of the first things damaged kidneys lose is the ability to concentrate urine. Healthy kidneys make concentrated urine overnight, partly because you're not eating or drinking, and partly because of a hormone called ADH that tells your kidney to conserve water. Damaged kidneys can't do that anymore. So instead of one concentrated output, you get multiple diluted ones. If you're waking up 2, 3, 4 times a night to use the bathroom, and that's a new pattern for you, that's not normal aging. That could be one of the earliest signs of kidney dysfunction. Sign number 6, a metallic taste in your mouth. This one catches people completely off guard. When uremic toxin build up in your blood, some of them make their way into your saliva. The bacteria naturally living in your mouth break those toxins down into ammonia and other compounds. And those byproducts stimulate taste receptors on your tongue. Most people describe it as tasting like metal, like licking a coin. The same compounds also affect your breath. It starts to smell faintly of urine. Doctors call this uremic fetor. And when your food tastes like metal and your breath smells wrong, your appetite disappears, which leads directly to the next sign. If your favorite food suddenly tastes off and it's been going on for weeks, don't just blame your taste buds. Sign number 7, loss of appetite and nausea. And this one has a really specific mechanism that most people don't know about. There's a region in your brain called chemoreceptor trigger zone. It has no blood-brain barrier, which means it's directly exposed to whatever is circulating in your blood. Its job is to detect toxins. When it finds them, it tells your body to stop eating and to vomit to protect you from poisoning. Except when the toxins aren't coming from bad food, they're coming from failing kidneys. Uremic toxin triggers that sensor. Your brain thinks you're being poisoned, so it shuts down your appetite. Nausea, no hunger, unintentional weight loss over months. If that sounds familiar and you can't explain why, your kidneys deserve a closer look. Sign number 8, restless legs syndrome. This one surprised people because it doesn't sound like a kidney problem. But here's a connection the research keeps pointing to. When kidneys are damaged, they can't properly regulate iron metabolism. They also produce less a protein called hepcidin, which controls how iron moves through your body. When iron delivery to the brain drops, dopamine production drops with it. And dopamine is what keeps your legs from feeling like they need to move constantly at night. People describe it as a crawling sensation or pulling, an urge to move your legs that you physically cannot ignore. A 2021 review published in the Journal of Clinical Sleep Medicine found that restless leg syndrome affects up to 25% of people with chronic kidney disease, compared to about 5 to 10% in the general population. 5 times more common, and most people have no idea the two are connected. If you can't keep your legs still at night and it's been getting worse, that's not just a sleep problem. Sign number 9, muscle cramps, especially at night, especially in your legs. When kidneys lose their ability to regulate electrolytes, calcium drops, phosphate builds up, magnesium gets thrown off, your nerve and muscle signaling goes haywire. There's also something called metabolic acidosis. When kidneys can excrete enough acid, your blood becomes slightly too acidic. And acidic blood directly impairs muscle functions and nerve firing. The result? Painful, sudden contractions, usually in your calves, that wake you up at 3 a.m. for no obvious reason. Dehydration causes cramps too. So does exercise. But if your cramps are frequent, severe, and happening even when you're resting. Sign number 10, easy bruising and slow healing cut. Healthy platelets are what stop you from bleeding. They stick together, form a block, and seal the wound. But uremic toxins, specifically a compound called guanidinosuccinic acid, directly interfere with platelet function. They coat the platelets and make them less sticky, less able to clump together when you need them. So a minor bump that you wouldn't even notice leaves a bruise. A small cut takes twice as long to stop bleeding. You're not fragile. Your platelets are being poisoned. If you're noticing bruises you can't explain, especially on your arms and legs, and it's a new pattern for you, that's one more piece of the puzzle. Sign number 11, half and half nails. Remember I told you at the start to look at your nails? Here's what you're looking for. Hold your hands out, look at your fingernails. A normal nail is pale pink near the base, with a lighter white area near the tips. Half and half nails, also called Lindsay's nail, look different. The bottom half of the nail is white or pale. The top half is brown or reddish brown. A sharp line divides them. The exact mechanism isn't fully understood, but is thought to involve increased melanin deposition and changes to the tiny blood vessels under the nail, both driven by uremic toxins. It shows up in about 40% of people with chronic kidney disease. Most of them had no idea it was there. Look at your nails right now. Do you see a clear line dividing them in half? Sign number 12, bone loss and fractures. This one invisible until it isn't. Here's a chain reaction. Damaged kidneys can't activate vitamin D properly. Without active vitamin D, your gut absorbs less calcium from food. Blood calcium drops. Your parathyroid glands detect that drop and release PTH, parathyroid hormone, to compensate. PTH pulls calcium out of your bones to top up your blood levels. Over time, your bones lose density. They become brittle. People fracture a hip doing something completely ordinary. Some people lose an inch or two of height without realizing it. A 2019 study in the New England Journal of Medicine found that people with CKD have fracture rates 2 to 4 times higher than the general population. Your bones are being quietly dissolved, and most people find out when something breaks. Sign number 13, Calcinosis Cutis. When phosphate builds up in your blood, it binds with calcium to form crystals, and those crystals need somewhere to go. Sometimes they go under your skin. You feel them as hard, white, chalky lumps, most often on your fingers, elbows, or around your joints. Press on them and they don't move. They don't hurt at first. They just sit there, getting bigger. In advanced cases, the skin above them breaks down, and what comes out looks like thick white paste, dense, gritty, almost like wet chalk being forced through tissue. That's not an infection. That calcium phosphate that your kidneys were supposed to clear and couldn't. If you find hard lumps under your skin that were not there 6 months ago, especially near joints, don't assume it's a cyst. Get your phosphate levels checked. Sign number 14, artery calcification. Same crystals, different locations, much more dangerous. When calcium phosphate deposits build up inside your artery walls, the smooth muscle cells that normally keep your arteries flexible start behaving like bone cells. They lay down mineral into your wall itself. A healthy arteries feel like nothing under your skin. Soft, pliable, almost invisible to the touch. A calcified arteries feel like completely different. Run your finger along the inside of your wrist where you check your pulse. If the arteries feel like a rigid tube, like pressing down on a thin plastic straw embedded under the skin, that's not normal. That's mineral inside your vessel wall, permanently. And here's why this matters beyond the artery itself. Rigid arteries can't absorb the pressure of each heartbeat the way flexible ones do. That pressure goes somewhere else, directly into your heart, your brain, your kidneys. People with chronic kidney disease don't just die from kidney failure, they die from heart attacks and strokes. And this is exactly why, sign number 15, Uremic Frost. This one is rare. You won't see it until kidney disease, a very advanced stage. When urea concentration in the blood becomes extremely high, urea starts secreting through sweat glands onto the skin. As the sweat evaporates, urea crystals are left behind, a fine white powder on the skin, like frost. It looks exactly like what the name suggests. Sign number 16, pericarditis. The sac around your heart is called the pericardium. When uremic toxins reach high enough levels in the blood, they inflame the sac. The result is chest pain that gets worse when you lie down and better when you lean forward. And a sound, doctors call it pericardial friction rub, like two pieces of leather rubbing together with each heartbeat. This is a medical emergency. Uremic pericarditis means toxin levels have reached the point where they're directly damaging the lining around your heart. It's one of the original indications for starting dialysis. If you have kidney disease and develop unexplained chest pain, do not wait. That's not anxiety. That's your body telling you it's out of time. So, what do you actually do with all of this? First, if you recognize more than 2 or 3 of these signs in yourself, don't panic. But don't ignore it either. Book a basic kidney panel. It's a blood test for creatinine and GFR and a urine test for protein. That's all it takes to know where you stand. Second, the root causes. The research is very clear on this. The 2 biggest drivers of chronic kidney disease worldwide are type 2 diabetes and high blood pressure. If you have either one, managing them aggressively is the single most important thing you can do for your kidneys. Third, and this one surprised people, be careful with over-the-counter pain medications. NSAIDs like ibuprofen and naproxen, taken regularly over months of years, directly damage kidney tissue. Most people have no idea. Your kidneys have been quietly doing everything for you. The least you can do is check on them once a year. This video is for educational purpose only. Please talk to your doctor before making any health decision. I'm Maya Chan, and I see you on the next one.